My name is Chief Godwin Uche from Nigeria. What brought me to India is prostate cancer.
It all started when he did a lab test, and it was diagnosed that he had a enlarged prostate. So first of all, we went to a private hospital in Abia State and did the operation. They did laser. So after the operation, they have to take the biopsy to the lab. So it was tested and discovered that he had a cancer.
Mr. Godwin Uche is a 64-year-old gentleman from Nigeria who contacted us first from his country when he was diagnosed with prostate cancer. He had undergone transurethral dissection of prostate for his urinary symptoms, and the final pathology had revealed that he had some cancer cells in his prostate.
Before the surgery, he was depressed because of the things we hear about cancer. But when we came here, the doctors told us that his case is a case that they can be treated, that once they do the surgery and remove the prostate, that he will be cancer free.
Having received all the reports, we discussed his case in the Uro-Oncology multi-disciplinary tumor board, and we came to a conclusion that robotic surgery would be the best treatment option for him. We conveyed the same to him, and once he was convinced that robotic surgery was the best option for him, he decided to come down to India and get the surgery done with us.
The doctors that handle me, they are very kind, caring. Even the patient, the nurses, every hip body here, that they are special. I love the way they work as a team.
The surgery was a robotic radical prostatectomy with bilateral lymph node dissection. The surgery was uneventful, albeit it was a little tricky because of his previous surgery that he had on his prostate, but there was hardly any blood loss, and his post-op recovery was also very smooth.
Dr. Tushar and his team, they are very kind, they are good. Even when my husband was on admission, they come regularly to check on him to see how he's progressing. It's very good.
The Dr. Tushar Aditya is a very kind person, and their team, they did very well. They did very well, and I pray that this will be the end of my problem. He assured me that he's going to do it well, and I believe they've done the best.
And we are happy that now he's fully cured of his cancer. And the final biopsy also revealed a very low aggressive disease, and we are confident that he should not have a recurrence. All that he needs to do is a regular PSA blood test, and he should be fine and free from prostate cancer.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.